I discovered my prediabetes not through a blood test, but through my feet. 3 years ago, I noticed persistent tingling in my toes that I initially dismissed as poor circulation from sitting too long at my desk. When I finally measured my fasting glucose, it was 118 milligrams per deciliter, well into pre-diabetic territory. My HbA1c came back at 6.1%. After implementing the metabolic protocols I'll discuss today, my fasting glucose dropped to 87 milligrams per deciliter, and my HbA1c normalized to 5.2%. I'm a professor of genetics studying metabolic regulation and cellular health. Today I'm sharing the 9 critical foot warning signs that could indicate diabetes or prediabetes, and what they reveal about your underlying metabolic state. Why your feet reveal metabolic dysfunction. First, your feet represent the furthest point from your heart, making them uniquely vulnerable to the microvascular and neurological damage that elevated blood glucose produces. The capillaries in your feet are among the smallest in your body, approximately 5 to 10 micrometers in diameter. When blood glucose remains chronically elevated, these microscopic vessels experience glycation damage first. Glycation occurs when glucose molecules bind to proteins, forming advanced glycation end products, or AGEs. These accumulate in vessel walls, reducing elasticity and impairing blood flow. Simultaneously, elevated glucose damages the myelin sheath surrounding peripheral nerves. When glucose enters nerve cells, it's converted to sorbitol, which creates osmotic stress that disrupts nerve function and eventually causes nerve cell death. Research shows that peripheral neuropathy affects approximately 50% of individuals with diabetes. But critically, up to 25% of individuals with prediabetes already show early neuropathic changes. Your feet may signal metabolic dysfunction years before a formal diagnosis. My own tingling preceded any awareness of my elevated glucose by an estimated 12 to 18 months. Had I recognized this warning sign earlier, I could have intervened sooner. Warning sign number 1: tingling, numbness, or pins and needles. The most common early warning sign is abnormal sensations, described as tingling, numbness, or pins and needles in the feet and toes. This represents early peripheral neuropathy. Chronic hyperglycemia damages peripheral nerves through multiple pathways. Small fiber sensory neurons, responsible for detecting temperature, pain, and light touch, demonstrate damage earliest. These fibers have the longest axons extending to your feet, making them particularly vulnerable. The progression typically begins symmetrically in both feet, starting at the toes and gradually ascending. Patients describe the sensation as wearing an invisible sock, a boundary where normal sensation transitions to abnormal. My tingling began in my great toes bilaterally. Initially intermittent, it became constant over approximately 6 months, intensifying at night, a pattern consistent with small fiber neuropathy. Action step: if you experience persistent tingling or numbness lasting more than 2 weeks, get fasting glucose and HbA1c testing. Also request fasting insulin. This reveals insulin resistance, often years before glucose elevations appear. Warning sign number 2: burning pain, especially at night. Burning pain in the feet, particularly prominent during nighttime rest, indicates progression to painful diabetic neuropathy. This affects approximately 25% of individuals with diabetes. When nerve fibers degenerate, they generate spontaneous electrical impulses interpreted as pain. This occurs because damaged nerves develop abnormal sodium channel expression, lowering the threshold for firing without appropriate stimulation. The nighttime exacerbation occurs because reduced environmental stimulation allows perception of these aberrant signals. During daytime activity, competing sensory input partially masks the pain. Targeted interventions. Alpha-lipoic acid, 600 milligrams daily, targets mitochondrial oxidative stress in neurons. Benfotiamine, 300 milligrams daily, inhibits AGE formation and blocks the polyol pathway. Acetyl L-carnitine, 1000 milligrams twice daily, supports mitochondrial function and nerve regeneration. Within 8 weeks of implementing these, alongside glucose normalization, my burning sensations resolved completely. Warning sign number 3, cold feet or poor circulation. Persistently cold feet, pale or bluish discoloration, or slow capillary refill indicate peripheral arterial insufficiency. Diabetes accelerates atherosclerosis through multiple mechanisms. Hyperglycemia promotes endothelial dysfunction by reducing nitric oxide, the master regulator of vascular tone. When endothelial cells are exposed to elevated glucose, they produce excessive reactive oxygen species that inactivate nitric oxide. Individuals with diabetes develop peripheral arterial disease at rates 3 to 4 times higher than non-diabetic individuals. Simple assessment. Press firmly on your great toenail for 5 seconds until it blanches white. Then release. Normal color return occurs within 2 seconds. Greater than 3 seconds suggests compromised arterial perfusion. My vascular protocol: L-citrulline, 500 milligrams daily on empty stomach, converts to nitric oxide. Omega-3 fatty acids, 3 grams EPA-DHA daily, reduces vascular inflammation. Beetroot powder, 1 tablespoon daily, provides dietary nitrates. My C-reactive protein dropped from 3.2 milligrams liter to 0.8 milligrams liter over 4 months. Warning sign number 4, wounds that heal slowly. Delayed wound healing indicates both microvascular compromise and immune dysfunction. Normal wound healing proceeds through hemostasis, inflammation, proliferation, and remodeling. Diabetes impairs each phase. Hyperglycemia reduces neutrophil function by up to 50%, impairs macrophage activity, reduces collagen synthesis by fibroblasts, and limits new blood vessel formation essential for healing. Minor cuts should show visible healing within 7 to 10 days. In my pre-diabetic state, a small cut on my heel took nearly 3 weeks to close, more than double expected. Supporting nutrients: zinc, 30 milligrams daily, picolinate form, essential for collagen synthesis and immune function. Vitamin C, 1000 milligrams daily, required for collagen structural strength. Protein, minimum 1.2 grams per kilogram body weight, emphasizing glycine-rich sources like bone broth. Warning sign number 5, frequent infections or fungal growth. Recurrent fungal infections, athlete's foot, toenail fungus, or bacterial infections indicate immune compromise. Glucose serves as the primary energy substrate for most pathogenic organisms. Elevated tissue glucose essentially creates an enriched culture medium. Research shows each 1% increase in HbA1c approximately doubles infection risk. Fungal infections particularly thrive because the combination of elevated glucose, reduced circulation, and altered skin pH creates ideal conditions. During my pre-diabetic period, I developed early toenail fungus that resolved without antifungal medication once my glucose normalized, demonstrating it was a symptom of metabolic dysfunction rather than an isolated problem. Prevention approach: optimize vitamin D, target 50 plus ml, improves antimicrobial peptide production. Change socks twice daily using moisture-wicking materials. Consider topical tea tree oil, 5% solution for nail beds. Warning sign number 6, skin changes, dryness, cracking, calluses. Excessively dry skin, deep heel fissures, or rapid callus formation indicates autonomic neuropathy affecting sweat glands combined with microvascular changes. Autonomic nerves regulate sweat gland activity. When damaged, eccrine sweat glands reduce output, eliminating natural skin moisturization. Research shows pseudomotor dysfunction affects up to 50% of diabetic patients and often precedes sensory neuropathy. Glycation also affects skin structure directly. Collagen and elastin become cross-linked, reducing flexibility and predisposing to mechanical fissuring. Heel cracks provide entry points for bacterial infection. Skin care protocol. Daily urea-based cream, 10 to 20% concentration after bathing. Nightly occlusive barrier on heels with cotton socks. Quarterly podiatrist visits for callus reduction. Warning sign number 7. Changes in foot shape. Gradual changes in foot architecture. Hammer toes, bunions, claw toes, collapsed arches can indicate motor nerve involvement. Motor neuropathy damages nerves controlling intrinsic foot muscles. Research shows intrinsic foot muscle volume decreases by up to 50% in diabetic patients with neuropathy. As these muscles weaken, the balance between flexor and extensor tendons is disrupted, pulling toes into abnormal positions. These structural changes alter pressure distribution during walking, creating calluses and eventually ulceration. Early detection. Photograph your feet from above every 6 months and compare images. Watch for shoes becoming uncomfortable or new calluses in previously unaffected locations. Prevention: daily foot strengthening. Towel scrunches, using only toes to pull a towel toward you. Proper footwear with adequate toe box width and arch support. Warning sign number 8. Loss of hair on feet and lower legs. Hair loss on the feet, toes, and lower legs indicates microvascular compromise affecting hair follicle perfusion. Hair follicles have high metabolic demands, requiring robust blood supply. When capillaries sustain hyperglycemic damage, blood flow diminishes below the threshold for hair growth. The pattern typically affects distal extremities first, starting at toes and ascending. This serves as a visible marker for underlying vascular pathology, simultaneously affecting peripheral nerves, kidneys, and retina. During retrospective examination of photographs, I observed subtle thinning of toe hair approximately 18 months before my glucose elevation was discovered. At the time, I attributed it to aging. Assessment. Compare hair distribution on your feet to historical photographs and to distribution on your thighs and upper legs, which should be unaffected early. Warning sign 9. Unusual foot odor. A distinctly sweet, fruity, or acetone-like odor can indicate ketoacidosis or advanced hyperglycemia. More commonly, musty or foul odors indicate fungal overgrowth or bacterial proliferation. In severely uncontrolled diabetes, the body switches to fatty acid oxidation, producing ketone bodies partially excreted through sweat. A sweet or acetone odor from feet, breath, or body represents a medical emergency. Diabetic ketoacidosis can progress to coma and death. Musty or foul odors, while not emergent, warrant evaluation for glycemic dysfunction driving microbial overgrowth. My daily protocol: morning, visual foot examination. Measure fasting glucose. Target below 95 mg DLE. Alpha-lipoic acid, 600 mg on empty stomach. Vitamin D3, 5,000 IU with fat. With meals, benfotiamine, 300 mg, zinc, 30 mg, omega-3s, 3 grams total daily. Magnesium glycinate, 400 mg. Evening, 15-minute post-meal walk. Apply urea cream to feet. Check for any cuts, blisters, or changes. Weekly, foot photograph documentation. Capillary refill testing. Check between toes for moisture or fungal changes. My results over 12 months. Metabolic markers: fasting glucose 118 to 87 mg DLE. HbA1c 6.1% to 5.2%. Fasting insulin 14 to 5.8 micro-IU ml. Symptoms: tingling resolved by month 3, burning resolved by month 2. Capillary refill 3.5 to 1.5 seconds. Hair regrowth observed on previously sparse areas. Common questions: can diabetic neuropathy be reversed? Early neuropathy, particularly in prediabetes, demonstrates significant reversibility with glucose normalization. Research confirms intensive lifestyle intervention can result in measurable nerve fiber regeneration. More advanced neuropathy shows limited reversibility, emphasizing early detection. What glucose level causes complications? Damage begins at pre-diabetic levels, fasting glucose above 100 milligrams DL, or HbA1c above 5.7%. The diagnostic threshold of 126 milligrams DL doesn't represent a biological cliff. Damage occurs along a continuum. Should I see a podiatrist? Yes. For anyone with confirmed diabetes or prediabetes, I recommend podiatric evaluation every 6 months, regardless of symptoms. Conclusion: my feet provided the earliest warning that my metabolism had shifted toward dysfunction. The tingling I initially dismissed represented years of potential intervention time I nearly lost. The foot serves as a window into systemic metabolic health because its distant position and small vessels make it exquisitely sensitive to hyperglycemic damage. Changes in your feet today reflect what is happening throughout your vasculature and nervous system. Research demonstrates that early intervention in prediabetes prevents progression to diabetes in up to 58% of cases. Your feet are telling you something important. Listen to them.